Hey, this is Dr. Jorge coming at you today to talk about one thing that most people just want to whisper about: STDs, sexually transmitted diseases. Now, before I start, there are just two words that I want to say: penis and vagina. There, I got that out of the way. So let's get rid of the giggle factor, let's get rid of the awkwardness, and let's just get real talking about what STDs are, what symptoms they have, what harm they can do to you, and what you can do to prevent them and treat them. All right, so what's an STD? You know, it doesn't take a mental giant to figure out that it's a sexually transmitted disease. Therefore, it's some sort of infection, all right, that's transmitted from body-to-body contact. So if you touch, that might be too much. So let's talk about the four main types of sexually transmitted diseases. One, bacterias. The two main ones being gonorrhea and chlamydia. Number two, herpes virus, the gift that keeps on giving, unfortunately. And number three, human papillomavirus, also known as genital warts. And last but not least, unfortunately, the HIV virus. All right, young dudes and ladies, let's talk about the first STDs that I mentioned: chlamydia and gonorrhea. Now, we've all heard about them, and nobody wants to get these. The first symptoms that you get with either chlamydia or gonorrhea is a burning in the genital area. So for guys, that means that when you pee, your penis is going to burn maybe all the way through or right at the head. And for girls, for young women, this means that sometimes your vagina may be really itchy, all right, may have a whitish type of discharge, and there may be a lot of pain during sex. Now, the way that you catch gonorrhea or chlamydia is very simple: flesh-to-flesh contact. And again, keeping it real, you don't even have to put it in to get gonorrhea or chlamydia. So if you think that just rubbing it isn't really sex and isn't really dangerous, think again. The good news is that you can treat both gonorrhea and chlamydia with a simple antibiotic. So if you have any of those symptoms, don't be scared. Call the doctor. All right, so number two is probably one of the most infamous sexually transmitted diseases: herpes. Herpes is a virus, and now a virus is a lot smaller than a bacteria. The big deal here is that the herpes virus can get under the skin of either the penis, the vagina, the lips, the eyes, and it can just start living there forever. Now, when something irritates the herpes, it creates a big ulcer or a big sore. The problem is that once you get herpes, it's really difficult to get rid of. Actually, you can never get rid of it. So you take medications to make the symptoms be a lot gentler, and maybe it lasts a little less long. But unfortunately, once you get it, you always get it. So that's why you got to think ahead before making that genital contact. All right, rounding out number three is the human papillomavirus. This is what gives genital warts. All right, dudes, if you think that this is only something that happens to girls, think again. Genital warts are basically, well, small little cauliflower type growths that happen anywhere in your private parts. And unfortunately, just like herpes virus, these boogers live under the skin, and they irritate the skin so much that with years of having HPV untreated, anything can turn into cancer. You can have anal cancer, you can have vaginal cancer, cervical cancer, penis cancer. Come on, not a good thing to have at all. Again, the best thing to do is to cover your genitalia when you're having skin-to-skin contact. There is some good news though. There's now a vaccine that's recommended for all young ladies to get. And why women more than men? Well, 18% of all girls end up getting human papillomavirus while they're teenagers. Tell me that we're not having unprotected sex. Okay, listen up, dudes, and I mean you too, ladies. The last one is HIV. And for those of you that think that HIV is a thing of the past and that nobody dies from AIDS anymore, think again. One of the greatest subgroups that's getting HIV are teenage boys and girls, young men and women that don't think that they can get HIV. You know, we could all discriminate, but the virus doesn't. So it doesn't matter if you're black, white, Hispanic, gay, straight, the virus can infect you. And how do you get HIV? Pretty simply, by having unprotected sex, by putting your fluids in somebody else. And again, that doesn't mean full-on sex sometimes. It could just be skin-to-skin contact. You may not even stick it in. You may just think that rubbing it is safe. The truth is, if there's moisture that goes from one person to the next, you can get HIV. And HIV might have no symptoms in the beginning, and Lord, years later, you may end up with full-blown AIDS. So I've talked about the 4 major forms of STDs. And the bottom line is that, guys, if you really respect your partner, take care of them and be responsible. Ladies, if you really want to be independent, assert yourself and say, you know what? No glove, no love. So what's the bottom line? Be smart and be careful.